Hello, everybody. Thanks so much for joining me here for Wave Now. I'm Myra Ansari. So today we are going to Norton Children's Hospital talking about hypertension and children. We often think that hypertension impacts adults, but that is not the case. A new study finds increased risk for hypertension among kids living in underserved communities. So today, Dr. Heather Felton from Norton Children's Medical Group is going to be talking to us about this study that came out in the Journal for American Medical Association, talking about children and teens. They're more likely to be diagnosed with hypertension if they lived in deprived neighborhoods. Now, if untreated, hypertension can lead to more serious conditions like heart disease. Norton Children's wants to make sure that other families get the insight that they need about this study, and also to give them steps that they can take to ensure that their children have a healthy blood pressure. So they are getting set up right now to talk about this. Dr. Heather Felton, again, she's with Norton Children's Hospital, and today's topic is talking about hypertension in children and what we can do to help kids in our community. They're getting started, so let's listen in.
All right. Dr. Felton, I think we're ready to get rolling. Let me get set up here. All right. So thanks, everybody, for coming to this. We wanted to highlight a recent study that was released on hypertension, and especially among youths that live in underserved communities, and how socioeconomics has impacted high blood pressure and that sort of thing. And we also wanted to touch on ways that you can help, especially by creating a relationship with your pediatrician. So right now we have Dr. Heather Felton with Norton Children's Medical Group. Dr. Felton, if you could just give us a brief introduction of yourself, and we'll get rolling.
My name is Dr. Heather Felton. It's HeatherFelton. I'm, like Kevin said, I'm with Norton Children's Medical Group, specifically at Norton Pediatrics, Germantown in Louisville.
Recording in progress.
Okay. So to start off, Dr. Felton, what did this study from the Journal for the American Medical Association find regarding youth hypertension based on their communities?
So what this study was, it was published in JAMA, and it took a look at how a neighborhood that a child grows up in, and they use something called the Area Deprivation Index. So it's a measurement of lots of different socioeconomic factors that may affect the neighborhood, and how that is related to children's health, specifically hypertension and the development of hypertension. There have been lots of studies that have looked at other factors and how they may play a role in that disease process. So things like genetics and diet and exercise and all of those things. This is the first study like this where it looked at the neighborhood where a child came from.
So what happens when there's living in this high deprivation areas? What sort of findings did they come up with based on their study of these Delaware Medicaid recipients?
So they found an increase of about 60% that these kids tended to develop hypertension more often than their peers who didn't live in these neighborhoods. And so it's a significant finding based on this one aspect alone.
So why is this an important study? Why is this something that you as a physician are interested in?
I think it's important because, as I said before, we've looked at a lot of the other different factors that can play a role in the disease process. Anytime that we can understand, especially when you're talking about prevention, when you're trying to predict who's at risk for certain medical conditions, you have to see it before it happens. And so what this study does is it says, it gives me something else to look for. I could look at the family history and try to predict which of my patients is at high risk for developing hypertension. This gives me another clue to say, this is a patient I can identify that I might want to watch a little bit more closely, or be able to give more appropriate guidance on in order to prevent something from happening.
And what what are some things that can, I guess, what are the risks associated with hypertension? What can that develop into as kids age into adults?
So the thing about hypertension is that it can cause heart disease long term, and that's the number one cause of death in the United States. But the thing is that it's progressive. So the longer that you have hypertension, the higher the risk for developing complications from that in the future. And so if you develop hypertension as an adult, you are going to have spend less time having those high blood pressures than if you develop it as a child. So if you have high blood pressure that starts when you're 12, then you've already had it for 20 years by the time you're 32. And so you start seeing those complications even earlier in life. So if we can identify it early, stop it early, and then prevent those complications from happening, that's the goal.
So how do we treat hypertension in kids?
So the first line of treatment for children usually is to lifestyle changes. We recommend healthy diets. We recommend exercise, which would include probably some cardio when they're older. So puberty and later, you want to think of strength training too, but we don't do a whole lot of it in like the really young kids. But really, we talk about diet and exercise, stress reduction, things like that to help prevent hypertension in kids. There are medication therapies that can happen later, but it's usually once those options don't work.
And what are some ways that Norton can help, or specifically Norton, but what are some ways that we can help kids that may suffer from hypertension, or just kids who might not have that regular cadence with the physician? What can we do to help them?
So I think that the first step really is to find a pediatrician and make sure that you're staying up to date on all of their regular well visits. So one of the things about there's a difference between just having a one-time high blood pressure reading versus having hypertension. And so we wouldn't call somebody having hypertension after just one visit alone. We would say after you've had the same high or elevated blood pressure 2 or 3 consecutive visits, would we then call it hypertension. So in order to make the diagnosis, you do have to have regular treatments with your doctor, or regular visits with your doctor in order to catch it. So I think the first step really is to make sure that you have your regular doctor, a pediatrician who you're following. The other thing that makes it complicated in kids is that it's a moving target. So what is considered a normal blood pressure is always different depending on how old, but also how big the patient is. So we use the height to also determine what is an acceptable blood pressure reading for a child. And so having those regular visits is really important.
And just as a bit of a point of, if you wanted to mention this, that's fine. But I wanted to highlight that we, through our Norton Children's Prevention and Wellness Program, we have healthy cooking and eating for families, including virtual options. This is called Growing Cooks. So we teach families and kids how to buy, prepare, and cook meals, healthy meals. And there's also our telemedicine options that we have inside JCPS schools right now too. So there's a lot of different ways that we're trying to connect with folks and get them on the healthier lifestyle.
Absolutely.
So before I open up to questions, is there anything else you wanted to add, Dr. Felton?
Not that comes to the top of my head.
All right. Does anybody have any questions? You can either open your mic and ask away, or put it in the chat and I'll ask Dr. Felton. All right. Unless there's anybody rushing to unmute themselves, I don't think we have any questions. So that's great. Dr. Felton, I appreciate your time, and everyone, thank you for helping us get the word out on this important topic.
Yes, thank you.
I'll send this recording out to everyone on conclusion, but hope you guys have a good rest of your afternoon.
Recording stopped.